very much, re a leboga. Ke leboga the program directors, re leboga molaetsa go tswa go our comrades from the civil society. I just want to assure them, and I'm just assuring them in front of you, because we spent the afternoon together with the MEC, together with the Premier. We met Rekopanele, the civil society, Kamoholong Mona, for over 3 hours. Today. So we met here for more than 3 hours, just across here at the hall with the civil society comrades. And we thank them for the outreach program which they were leading over the last 2 days. And yesterday we received the report in terms of the work which had been done. And we can assure them, as we did also together with the Deputy President on a virtual meeting on Tuesday, where the matters regarding this funding for SANAC were thoroughly discussed, and there were commitments which were made. So I do understand that comrades just want to emphasize in their own style the way they feel strong, but we want to assure them that we are together. There is no difference on that matter. No one amongst us as the stakeholders in SANAC being composed of government, the civil society in all its various sectors. Civil society alone has up to, I think, 18 or 19 subsectors within it, including labor, including people living with HIV, including also, I'm not going to mention all of them, but just under 20 subsectors within the civil society. So there is no difference on the matter of making sure that SANAC remains sustainable and that we can take it at a higher level. So I thought, let me just deal with that matter to say we appreciate the comrades, we appreciate the manner in which they want to bring this to the attention of everybody here and to South Africa as a whole and to the world as a whole. And we are pleased that we do have a very active and very vibrant civil society. And I was saying yesterday when we were meeting there that don't think they do this only when we have activities like this to bring attention to the issues they feel strong. 2 years ago, when we were in Montreal at the International AIDS Conference, you know, there was an unhappiness about certain issues, and the civil society members ascended to the stage to voice those objections. And once you hear Amandla in Montreal, how go Montreal go to Amandla awetu watsiba hore se batho ba Canada ba watsiba hore se ba Canada batho ba. So we knew that South Africans have arrived. So I think let's take it in good spirit. Comrades feel very strong about the issues. Let me also recognize in absentia Premier, as I said, we're together here. We spent a lot of time together with the comrades addressing a number of issues. All my colleagues, ministers, deputy ministers, president, and thank you very much. And I know that Deputy Minister Jomo was with us in the church, Methodist Church this morning, but also went to another church on behalf of the Deputy President, our mayors, Executive Mayor for Sidibeng, and also Mfuleni, Deputy President of Salga, also civil society already spoken, and we have seen them. The WHO country rep, Dr. Kalua, the private sector forum represented by Mayor Mpumisi Kalala. Just to say on Dr. Kalua, I think he has already mentioned that in his capacity as a country representative, we are seeing him for the last time. He's been a very reliable partner with us as the country head of the World Health Organization here in South Africa. We wish him well in this new deployment, and we will be welcoming. We will give similar support to his replacement as a WHO country head. We also In our midst, we also have from United Nations AIDS, UNAIDS, Eva Kiwango, who is the country head for UNAIDS, from the Labour, Comrade Simon Hlongwane, who spoke on behalf of the President of COSATU, our leaders from government, the DG is here, the CEO of SANAC. Ladies and gentlemen, as already explained by the MEC earlier on, our chairperson and the Deputy President of the Republic has not been able to be with us today because of other engagements, other matters of state, which is very important. But he has delegated that to myself today to come and share the message which he would have been able to present in front of you. So Remona Mosi Dibe Mogutlisa Molaetsa o tswang go Motlatsa President wa naga Ntate Paul Mashatile ile yana ntumileng gore ke tlisetse molaetsa mo letsatsing la ka tseno le letsatsi le legolo la gore re gopoleng bolwetse bo bja tuberculosis. Pele re tsena molaetseng, before we go deeper into the message, I would like us to take some moment to extend our deepest condolences to the SANAC disability sector for the untimely passing away of one of our leaders, Dr. Jack Lloyd. He was at the forefront to ensure that the voices of people with disability are always heard in the forefront. His vision for a society free of discrimination and stigma inspired countless individuals to join the cause and work towards a more equitable future for all. His unwavering commitment to inclusivity and accessibility has left an indelible mark on the landscape of in disability advocacy in our country and beyond. The disability sector and the civil society sector as a whole will be poorer without him. Can I request that we take a moment just to rise in silence for a minute in dipping our banners in respect of Comrade Dr. Jack Lloyd and his family. Just a moment of silence, please. Even at the corner there, re kgopela motsotso wa gore re tlhomphe o re tlogetse mo lefatsheng comrade wa rena Ntate Jack Lloyd. Thank you very much. Thank you. I'm sure comrades will pass the message to the family. I know that a number of colleagues, the CEO of SANAC and also Deputy Minister Jomo were present on our behalf at his funeral in Gordons Bay in Western Cape. We want to thank everyone. Let me thank the Gauteng MEC and all those who played the role in making sure that we have this activity of the World TB Day today. There can be no argument that batho ba mo Sidibeng, batho ba mo Everton can ba sebetsa le rona hantle in our campaign to make sure that South Africans can live a long and healthy life. It's very rare that on the World TB Day, re hwetsa attendance e kana ya setšhaba mo re fitlang teng ga re tlo ira World TB Day. A re shapele matsogo batho ba Sidibeng. As already mentioned by various speakers, this commemoration takes place more than 100 years since the confirmation of this bacteria called Mycobacterium tuberculosis, which was discovered by a German scientist known as Dr. Robert Koch just over 140 years ago. And on this day, that's when it was properly registered, and that's why it was then put by the World Health Organization as a day on which we must commemorate and commit ourselves to the eradication of tuberculosis. We are here in our various sectors, government, civil society, and all of us to come and re-pledge ourselves towards zero deaths and zero suffering due to tuberculosis. We are gathered here to say with certainty that We have made some significant progress in our fight against TB, although a lot more still need to be done. We are here to assert our commitment as part of the world community to the total eradication of this preventable and also curable disease, which continues to kill thousands of people, if not over 1 million people annually throughout the world. We have seen the positive benefits of working together, and we want to build on this to eradicate TB once and for all, just like we managed when we work together throughout the world to eradicate diseases like smallpox. We believe indeed it can be done, even TB can be eradicated. We are here as we're getting closer and closer to 2030, which is the year that, along with other members of the UN and WHO, we have committed ourselves to ending TB, HIV, and STIs as public health threats. Today we are again here under the theme, yes, you and I can end TB. This theme aims to encourage not just organizations but also individuals to contribute towards these national efforts. It also emphasizes the importance of being accountable, starting as an individual and then going into the institutions and organizations in which we work. In our country, we are taking it further to say, working together, you and I can end TB, because indeed, this calls on unity of action. We are a nation built on and wired on the unity of purpose and united in action till we can achieve victory. We must declare that we will go hand in hand towards 2030 as we eradicate TB as a public health threat. You and I is a statement of intent designed to encourage individuals to take charge of their health in line with our Cheka Impilo program and objectives, as well as the country's endeavor towards finding those who are still missing in our endeavor to make sure that they get treatment for TB, HIV, and other diseases. This theme instills a hope and a renewed vigor as we move closer to 2030, which is partly the reason behind the decision globally to continue with this theme. As we go on this, we are also encouraged by some of our member countries within the UN, within G20, and the BRICS and other forums in which we belong, a country like India, which have taken a bold step to announce that their target is not 2030. They've announced that their target is 2025. And we believe that is a challenge to all of us, all the member states, to say, indeed 2030 is the target which has been set globally, but can we be able to be more ambitious? Of course, we have the biggest burden, and therefore we must be realistic in terms of, while we must be ambitious. It has been stated by public health experts and also at WHO that TB indeed remains the biggest public health threat, killing over 1.5 million. Just in 2022, the number had gone a little bit lower, but about 1.3 million people actually globally died from TB. And as the posters from the civil society was indicating, here in our country in the same year, over 50,000 people died from TB. And more than half of those are from the people living with HIV. So we have a big task, and we have a more urgent task more than many other countries. We have made some progress, but the challenge remains very high. In terms of the progress which we have made, we have seen a steady decline. Earlier on, when we were presented with the data before we came to this meeting, this was also indicated, but we are coming from a very high level. We have seen some significant decline, which is encouraging. If we look at the TB, the number of people who have diagnosed or who are estimated also to have TB in 2007, the figure was upwards of 600,000, at 644,000. But in 2022, this figure had gone down to just over 280,000. Also in the area of TB deaths, the number has been declining, but not at the kind of rate at which we would like to see it happening. Now, at last year's 24th of March, at the World TB Day, as a number of speakers referred to, we launched our National Strategic Plan for HIV, TB, and STIs for 2023 to 2028. This is the NSP, the National Strategic Plan, which will take us to our target, both in terms of the SDG, in terms of the UN and WHO, in terms of the SDG, but also in terms of our own NDP program. Within the health sector, led by the Department of Health, working under SANAC as well, we've also developed a TB strategic plan as a sub-program under the NSP, and also came with a TB recovery plan, which is making sure that on an annual basis, we can be able to measure our progress in terms of how we are doing. And already, Comrade Steve mentioned that this TB recovery plan was also endorsed by all sectors, by SANAC as a whole. And it is through this TB recovery plan that we want to make sure that the disadvantage which we suffered during the course of COVID, we can be able to recover all those. The successful implementation of this NSP relies on several critical enablers, such as the implementation of the TB recovery plan. We must scale up the implementation in the implementation and use of instruments such as rapid uptake of new tools. There are various new tools in terms of diagnosis and also in terms of treatment. Innovations such as the Gene Expert, which were one of the countries which made sure that we roll out a Gene Expert for diagnosis, which can give you very rapid diagnosis and more accurate. Also in the areas of treatment, whenever we come across more effective, efficient, and safer treatment, we don't hesitate to make sure that we make them publicly available. As we remain steadfast in our quest to end TB, we must also reflect on the challenges that still remain in our response efforts, which call on all of us to take collective actions. I will just state some of the challenges which you are aware of. We still have a lot of high number of missing TB clients. We are closing the gap in terms of our screening and testing. It's getting much more closer to the estimated number of TB prevalence in the country. So we are getting closer, but there's still a gap. We have a high detection gap amongst men. Men are not health seeking. So we have to follow the men. I think the MEC also spoke about that earlier on. We must find them wherever they are. So even if it means we must go to the Shebins, we must go and find the men wherever they are. We have also, our treatment success rate is still not acceptable, just hovering around 75, 77%, still not acceptable. We want to reach 90, if not 100. But also in terms of, that's in terms of drug susceptible, but also in the drug resistance, we still have a low recovery rate, just around 60%. We need to close that. The dual burden of HIV and TB also makes it even more difficult. We have also not yet rolled out sufficiently the TB prevention tools which are available. So these are some of the things which hinder our progress, and collectively we need to work together in making sure that we can strengthen our response. There has been a demonstrable will and desire from the government to use all the innovations, as I've mentioned already, in terms of diagnostic tools and also in terms of treatments. We have also, in terms of the rapid diagnostic tools, we have done so, but also in terms of rolling out, whenever we find new and more effective and safer drugs, we have been able to do so. We have rolled out the shorter regimens, such that while many people, I think Mayor Sbongile, ovulating earlier on more as a survivor of TB, did mention about injections which he had to undergo those years. We can assure the members of the community that we have now advanced. We have now advanced such that even in the treatment of drug-resistant TB, we are able to treat without some of those injections which were causing people to lose their hearing. So we have, and even reducing the length of treatment, even for drug-resistant TB. We are now working on a program where there are already about 2,000 patients who are on the program to reduce the treatment of even drug-resistant from 18 months to 6 months. So there's a lot of progress. We believe that this is going to be successful. However, we do recognize the fact that there are a number of areas where we must still redouble our efforts. We must make sure that there is equitable access to healthcare, particularly for those living with HIV and also other comorbidities, and also high risk and key populations. We must also work hard. Ms. Wongile also mentioned about issue of stigma. We have made a lot of progress. I think Comrade Steve also mentioned that we are nowhere where we were, whether you're talking about HIV or TB, maybe 20 years ago, but there is still stigma, there's still some stigma, so we need to make sure that we deal with those issues of attitudes, and that's why we need to keep on working together with leaders of civil society, our traditional leaders, our traditional healers, our faith-based leaders, to help us to deal with this issue. And I must say that this morning when we went to the Methodist Church, I was very impressed because they really embraced the health program. The Reverend himself was actually, before I could mention, he mentioned that we want to eradicate TB by 2030. That came from Muruti. So I didn't have a lot to say because Muruti already was aware. So we believe that we're bringing in such leaders, it will help us to eradicate the stigma. We will also do this by making sure that we up our communication, our social behavior change communication, which will improve knowledge and promote health-seeking behaviors, especially amongst men. So we are busy improving also our TB communication strategy. We must also promote, as I've mentioned, prevention, because there's a lot of progress in this area. And I must also mention, when you talk about prevention, that we are very happy to say today that there is significant progress in the area of research on TB vaccine. We know that we're very glad that when COVID struck, the scientists and the pharmaceutical companies were able to get vaccines very quickly, and TB and HIV has been evasive in terms of finding vaccine. But there's been progress recently in the development of a TB vaccine. We stand prepared to implement this once it is approved, once it is gone through trials. So we will be working very closely. In the phase 2 trial of the vaccine conducted by a pharmaceutical company called GSK, they tell us that the vaccine provided approximately 50% of protection against pulmonary TB for 3 years in people who were exposed to the bacteria, who were HIV negative. This result is unprecedented in decades of TB vaccine research. So they are ready to start with phase 3 of the research on the TB vaccine. Now we are happy that as South Africa, we will be part of the phase 3 research into the TB vaccine. They are ready to enroll more than 20,000 people into these trials. It will not only be South Africa, it will be South Africa, it will be Zambia, Malawi, Mozambique, Kenya, also outside Africa, Indonesia and Vietnam. So this gives us a lot of hope that we are not far from getting a TB vaccine. And we believe that this will be a major breakthrough. The last time there was any semblance of vaccine is what all of us, I hope, because it was compulsory, it's still compulsory here in South Africa, BCG. If we can say roll up your sleeve, I hope all of you will be found with a mark which shows that you did have BCG. So that is the only one which we have at this stage. We know that it's limited in terms of its protection, but we must continue to use it. But as other speakers have indicated, we are also conscious of the fact that government cannot win the fight against TB alone, because TB is also one of the diseases which are part and parcel of our social circumstances. TB, while it is a bacteria, it also thrives in people who are immune deficient. That's why it's very, very active and very, deadly in people who are HIV positive and who are not on suppression with HIV. But also people who are living in overcrowded situations, poor nutrition, all those. So, and also especially in the industries, in the mining industry. And we're very happy, Ms. Galala, because we have a very good relationship with the mining industry. in terms of making sure that they test their mine workers and even the ex-mine workers, so that those who have got TB can be treated, and those who deserve also some financial rewards because of the fact that they've been infected with TB due to working in the mines. And in doing so, we're not only working in South Africa, but also in the SADC region. We work also with an organization of ex-mine workers, South African Association of Ex-Mine Workers. We're working very closely with them to make sure that we can be able to eradicate tuberculosis. Now, ladies and gentlemen, we indeed are very committed to make sure that as I mentioned earlier before we came here, we are very clear that information and data is very important. Part of the problem currently, for instance, in this program of tracing ex-mine workers who suffered from silicosis, from TB, because we don't have reliable records from the mines and also tracing them, we're unable. There are many who actually have a lot of money available for them, but we're still struggling to find them. But also, as mentioned yesterday when we had the civil society, the major cry is the fact that both for HIV and TB, when people move, because it's normal for people to move around the country looking for better opportunities. When they move to other areas, they find that their records can't be traced. So in order to do away with that, we are indeed increasing our digital capacity to make sure that we have the information, dashboards to trace our work, but also to make sure that we have the digital information which makes sure that we can find the people, and when they arrive at different places, they just code their ID number, and then with their permission, they should be able to trace their information so that they can be able to get treatment. So this morning, our SANAC colleagues were showing us the Health Information Center, which is called the Situation Room, which gives you live information as to where we are. Any district in the country, any locality, you can be able to say with a button, how is this district doing? What are the difficulties? Which age group? And so on and so on. So we are very happy that also part of this function today is to officially launch this Situation Room, which we believe that is going to help us quite a lot in terms of moving forward. So there is a lot of data lying everywhere in the country, but because it is fragmented, it's not user-friendly, it's not helping us to make sure that we can see where we are and be able to take the process forward. But with this, we are sure that we're going to be able to move speedily. So that is the first matter which I wanted to announce here, that this is also an official launch of that Situation Room. So all the sectors, all of you who are involved in work in TB, you can contact our colleagues in SANAC. Whatever information you need, they will be able to work with you. The second announcement, which I must also make, was already referred to, that, and I'll come to it. We're very pleased that notwithstanding the challenges, notwithstanding all the challenges which we are having, we have made significant progress. We have made significant progress in terms of making sure that the TB work is properly funded. Now, in this regard, our team had reached a calculation that we need about 4 billion rand per annum to make sure that we can have a proper response to TB. And I'm happy to say we are not very far from making sure that we can reach this target with all of us working together. From government, as I mentioned, as the 71% contributor, from the Global Fund, contributing about 21% of that budget which we require, but also from our friends and compatriots from the US already, which Mr. Tillis mentioned earlier on. We have a commitment through the US Agency for International Development, USAID, of the award of the Accelerate Tuberculosis Elimination Program Resilience Activity, also referred to as the Accelerate. Through this program, the US government has committed an amount of $94 million to work with us over the next 5 years. $94 million, which is going to help us in this fight and brings us very, very close to our target of the budget which we require. So we want to say to Mr. Tillis, please pass our regards, our gratitude to the US government. I want to also just touch briefly on the fact that, as we know, 3 days ago we were at George Tabe Stadium with the President on Human Rights Day. Now, human rights also are health rights. Health rights are human rights. So we're pleased that SANAC has also begun the process of developing the second National Human Rights Plan, which will, an assessment has already started of human rights, assessing the human rights interventions of various role players. And this assessment and the plan will be finalized in July. So we thank all the role players in SANAC, which will make sure that we can also remember that as we do our work, we must do it within the context of human rights. Also that SANAC has also entered into an agreement with the Legal Aid Board to assist on information dissemination to marginalized communities on how legal aid can assist protecting the rights of vulnerable people. We also want to thank our faith-based leaders who are also working with us using the strength of faith to make sure that they can mobilize society and communities to be conscious of their lives. As I said this morning when we were in the church, the pastor also did say that their church, as the Methodists, are also used as pick-up points for our chronic medication. So we are happy that the faith-based leaders also understand that we're not only, even TB is not just a physical disease, it is also an emotional disease. I mean, for somebody to know that I've got an illness on which I need to take treatment daily without any missing, that is also a commitment which needs support. So we also want to thank our faith-based leaders for also working with us in all the areas of the response to TB and HIV. So access to TB services, we want to, as I conclude, it is our duty to make sure that access to TB services is equitable, it's seamless, and of high quality. And that's why we will do everything whenever there's a new innovation, once it is proven and properly registered with our regulators, we'll make sure that we access. Where it is too expensive, we're going to work together with all the partners, the civil society, to fight against too much profiteering, either on diagnostic tools or also on treatment tools. So working with our partners, we want to commit to say that we are going to invest all the possible resources to make sure that indeed by 2030, tuberculosis can be eradicated. Phansi nge-TB, phansi. Phansi nge-TB, phansi. Thank you very much.